Welcome to Healthward. I'm Dr. Memet Işık. In this series, we'll walk with you month by month through your baby's first year of life. Today, we're diving into the exciting and delicate world of your 1-month-old baby. Don't forget to like, subscribe, and hit the bell to stay informed each month of your baby's development journey. In the first month of life, your baby is still adjusting to the world outside the womb. Most of the time is spent feeding, sleeping, and bonding. Here are key developmental milestones to watch for. Motor skills. Your baby's movements are still jerky and reflex-based. You'll notice the Moro reflex. When startled, the baby flings out arms and legs. Their grasp reflex is strong. They'll hold your finger tightly. Vision and senses. Babies can focus on objects 8 to 12 inches away, just enough to see your face during feeding. They're drawn to black and white or high-contrast patterns. By the end of this month, your baby might start briefly following a moving object with their eyes. Your baby can, recognize your voice and may calm when they hear it. They might respond to loud sounds by startling or even crying. Early cooing or those sweet little throat sounds may begin toward the end of the month. Breastfed babies usually feed every 2 to 3 hours, which adds up to about 8 to 12 times a day. Formula-fed babies may feed every 3 to 4 hours. Look for 6 or more wet diapers per day. That's a really good sign your baby is well hydrated. Expect your baby to sleep about 14 to 17 hours in a 24-hour period, but not all at once. Day and night confusion is totally normal at this stage, and it's just too early for any sleep training. Always place your baby on their back to sleep to reduce the risk of SIDS. So, your baby's first pediatric checkup is usually scheduled around 1 month after birth, unless it was done earlier in week 1 or 2. Here's what you can expect during this visit. Your baby's weight, length, and head circumference will be measured. Their feeding, digestion, and sleep habits will be reviewed, and a developmental assessment will be done as well. Plus, the doctor will check how the umbilical cord is healing. It should have fallen off by now. When it comes to vaccinations, the hepatitis B vaccine is usually given at birth or at 1 month if it was delayed. And your doctor will help you plan the 2-month vaccine schedule in advance, so, it's good to get prepared. Here's a practical tip. Try keeping a baby health journal to record feeds, diaper changes, and milestones. It really helps with doctor visits and tracking your baby's development over time. So here are some practical tips for building a strong bond with your baby. Try using tummy time for just a few minutes each day. This really helps build their neck strength. Also, make sure to respond to your baby's cries promptly, because it helps them feel secure and cared for. And, maintaining eye contact and talking softly to your baby supports both bonding and language development. Now let's talk about some red flags you should watch for. If your baby is feeding poorly or consistently refusing feeds, that's a concern. No eye contact or no reaction to loud noises can also be a sign something's not quite right. Very floppy or stiff limbs are another thing to look out for. If you notice yellowing of the skin or eyes, which could be jaundice, or if there's persistent vomiting, not just regular spit-up, these are all important to notice. If any of these are present, you should contact your pediatrician immediately. New parenthood is joyful, but also exhausting. It's okay to feel overwhelmed. Make sure you get rest when the baby sleeps. Don't hesitate to ask for help from family or friends. Watch for signs of postpartum depression in either parent sadness, detachment, or anxiety that doesn't fade. Remember, taking care of yourself is part of taking care of your baby. That's your month 1 guide, full of growth, bonding, and beautiful beginnings. Next month, we'll talk about smiles, coos, and the next big leaps in development. Comment below, what's been the most surprising thing about your baby's first month? Don't forget to subscribe so you don't miss our month 2 update.